The imprisonment rate has peaked in 2007 at 506 inmates per 100,000 United States residents. Since then, the rate of imprisonment has been on a steady decline. Concerning the demographics of this group, males outnumber females in prison. However, this gender gap is shrinking. The male prison population declined between 2010 and 2013. In comparison, the female population has increased by 10% in the same time frame. For the past decade, African Americans have been 5 times more likely than whites, and 3 times more likely than Hispanics, and 9 times more likely than other races to have been in jail throughout their lives. This figure depicts the total state and federal prison populations in the incline within that group from 1978 until 2013. This figure focuses on the United States prison population compared to other advanced economies and depicts that the United States more than doubles that of the second highest country.
For years, healthcare providers for prisons have been under attack regarding the quality of care for inmates. There have been many similar cases leading to lawsuits against healthcare providers like Corizon, one of the nation's largest for-profit prison healthcare providers. Corizon provides the incarcerated with care for mental and physical accommodations, or so they say. Corizon contracts with over 500 jails and prisons in over 20 states and earns about $1.4 billion annually. Inmate allegations of mistreatment and poor care for inmates have recently caused Corizon to lose contracts with local prisons. On March 14, 2017, Denise Forte's daughter filed a lawsuit against Corizon, claiming that her mother's death in 2015 could have been prevented if adequate medical care was administered. Forte had lung disease and was ignored by a nurse when her symptoms worsened. Many accusations take place that they fail to meet basic medical needs, leading to inmates' deaths. Corizon is an option for inmates for them to receive care, but proves further the challenges the incarcerated face while in prison. While inmates are incarcerated, it is a law within the Federal Bureau of Prisons that they must be employed. Except those that are mentally and physically unable to work, all prisoners must maintain some form of employment during incarceration. Most inmates work within the prison, while some low security are able to work in neighboring communities as part of their release preparation. The types of jobs vary, including working in the facilities department, food service, education department, recreation, commissary, and many more. Their pay depends on duties, longevity, and performance. Most federally incarcerated inmates can expect to earn between only $10 and $25 per month, ranging from 12 to 40 cents per hour. The employment of these inmates runs these facilities, yet does not show in their low pay grades.
While transferring out of prison, there are a few supports that are put into place to help recently released inmates adjust to their life in society. Halfway houses are centers and organizations created to assist former drug addicts, prisoners, and psychiatric patients adjust back to life in society. Social workers work to help prisoners rehabilitate and prepare to re-enter their communities. To do this, they must work with the inmate and hopefully the inmate's family to create an action plan. Additionally, social workers help inmates strengthen their relationships with family members and friends. Probation officers supervise those who are on probation. They work with the inmates who have recently been released from prison to ensure that the probationer is not a danger to the community. In addition to this, probation officers write reports that detail each probationer's treatment plan and any progress made since being placed on probation. Each of these employees should also work to stress the importance of gaining insurance. This could come in the form of government insurance such as Medicaid or Medicare, insurance through a private provider, or insurance through a job that they obtain once out of prison. These employees should also work to stress the importance of taking the basic steps that are listed below after an inmate is released. The recently released inmate should work to obtain a cell phone, obtain a new form of identification if they don't have one already, find a place to stay or an address that they can list when applying to jobs. They should obtain health insurance as mentioned previously, apply for welfare and SNAP if applicable, and begin to search for a job.
Being released from prison creates a new set of problems for ex-offenders. While in prison, there's access to free health care and free mental health services, as well as pharmaceutical services. However, on the outside, they have to find their own form of health insurance. The prison population is at high risk for chronic infectious diseases such as asthma, hepatitis, hypertension, and HIV and AIDS. So not only will the ex-offender without treatment be a danger to themselves, they also can be a danger to communities and pass infectious diseases to others on the outside if left untreated without their medicine. They also suffer from mental health issues such as PTSD. The Affordable Care Act, passed by President Obama, has given 5 million ex-offenders assistance with insurance. Better access to health care for ex-offenders can lead to less hospital visits. Because many ex-offenders don't have a primary care physician or can afford insurance, they go to the emergency rooms for treatment. This holds up rooms for other people as well as adds to our medical costs. Providing ex-offenders with health insurance coverage and giving them the ability to seek out primary care physicians can cut medical costs. Being released from prison is a very exciting time for an ex-offender. However, being able to afford life on the outside can be very difficult for ex-offenders. Finding a job after being released from prison is the number one barrier ex-offenders have to face. Approximately 60% of ex-offenders remain unemployed 1 year after their release. Oftentimes, employers will see one's criminal record when they apply for a job, and they may deem that person as a potential risk to the company and not hire them. However, the lack of money affects the ex-offender's life. For example, not being able to find a job means not being able to have money to eat or clothing or even a place to live. This can lead to the cycle of incarceration. That person may get extremely frustrated that they can't find a job and then just go back to their old ways of making money illegally, and then they're reincarcerated. More employers are becoming open to hiring ex-offenders. Some of these companies that hire ex-offenders are Tesla, Ace Hardware, IHOP, Chrysler, and Chick-fil-A, and many more. These are two clips from Netflix's show Orange is the New Black, which is about an all-women's prison called Litchfield in New York. And this character, Aleda, recently got released from prison. The first clip is Aleda. She's trying to push and sell these herbal shake products, and she keeps on getting the door basically slammed in her face. She's having a really hard time. And then the second clip is her eventually caving into the pressure of not having money and basically selling drugs in the prison using the Herbalife shake.
Hello? You gonna sell her what?
Hey there. Is your mom home?
Don't got a mom.
Oh, well,
I'm kidding. She's out on the corner.
Okay.
Damn, I'm just kidding. She's out selling fucking Arbonne. So you can't get her in on your janky pyramid scheme, because she's already in one.
Hey! You weird little brat! Why you think your mom's out there selling shit, huh? For you!
New year, new chapter.
This is so much better than the shit you was bringing in. It's good shit. This is gonna work, right? No money, no more.
She needs to enter the numbers, and it goes straight onto her card. It's all there.
There are many recommendations that society can use to increase change. Focusing on health, we can improve insight and accountability of inmate healthcare, including making accreditation of prison healthcare mandatory and enforceable. We can connect inmates with the community physician and psychiatrist prior to their release in order to enforce healthcare upon their release, leading to decreased substance abuse. Focusing on wealth, we can connect inmates to primary care physicians, decreasing the need for emergency services, which supports the community. And finally, we can increase opportunities for inmates to have low-paying jobs while in prison to then transfer to their accounts once they are released.